But we start with new information indicating that fewer people could die of the coronavirus in the U.S. than previously predicted. And good evening, I'm Juliette Goodrich.
And I'm Brian Hackney. It could be used as an argument to open up the economy sooner. KPX5's Kenny Choi talked to some of the top disease experts in the country.
This certainly is good news, but tonight there is a warning from leading experts on COVID-19. They say that if the lockdown measures in place are not continued, we could see a spike once again. Protests have erupted in some states over the shelter-in-place strategy.
This is not the time to back away from the measures that are already working.
The Institute of Health for Metrics and Evaluation just lowered its nationwide projection to just over 60,308 deaths.
I think this is good news, but understand that this stuff can go sideways in a hurry.
Dr. Christopher Murray is the director of the IHME at the University of Washington.
Looks like a number of states in the South, for example, will have smaller epidemics than we were expecting.
A number of areas like California and the Bay Area have successfully flattened the curve, if you will, and sheltering in place and the measures we've taken have had an impact on the transmission of the virus.
Experts initially estimated the Bay Area would suffer 44,500 deaths. It's at 170 to date.
So I think we're in good shape in the Bay Area and in California and on the West Coast. Other states that are playing around with this are playing with fire.
The White House and Trump administration have touted the IHME model and recently declared several states to open up their economies, including Minnesota and Michigan. But Reingold believes factors like the rate of current transmission, hospital needs, testing capacity, and contact tracing, among others, need to be considered.
So I think governors are really trying to make this decision based on those kind of factors and not really on some national model, frankly.
Dr. Rutherford of UCSF says that opening up the economy and lifting these measures too early could end up being a direct lesson of the 1918 influenza epidemic. If it's done too early, it all could come back next week. In San Francisco, Kenny Choi, KPIX 5.